I'll establish appropriate BSI precaution. I'm going to complete a primary assessment, and I'll administer high-flow oxygen if indicated. I'm going to complete a secondary survey where I'll obtain vital signs and a pain scale. And I'll verbalize the 4 criteria for assisting patients with their own medication. First, the medication must be prescribed to the patient. Second, the patient must meet the indications for aspirin. Third, that there are no contraindications. And fourth, that ALS is en route. There are 3 indications for assisting aspirin. First, that the patient is alert. Second, that they have non-traumatic chest discomfort of suspected myocardial origin. And third, that they are over the age of 30. There are also 3 contraindications for assisting aspirin. First, that they do not meet the indications. Second, the patient has a history of a GI bleed or a peptic ulcer disease. And third, that the patient has a hypersensitivity or allergy to Motrin or NSAIDs. Going into my medication. The proper adult dosage is 324 milligrams. I'm checking the medication for the name of the drug, the integrity of the container and medication, the concentration and dose, the clarity, and the expiration date. I'm also checking for the 5 rights for medication administration. I'm checking that I have the right patient, the right medication, the right dosage, the right route, and the right time. Going into the procedure. I'm removing the proper number of tablets from the container. I'm removing the oxygen source from the patient. I'll ask the patient to open their mouth. And I'll place the proper number of tablets into the patient's mouth and instruct the patient to chew the tablets. And I'll replace the oxygen source. For my reassessment, I'll make appropriate decisions based upon my reassessment findings and the patient's response to the interventions. I'll replace the cap on the medication bottle. I'll give appropriate report to equal or higher level of care, and I'll perform this procedure in a safe and appropriate manner.